Medic Mind. Motivate, mentor, maximize.
Welcome to this video on safety and quality. There are three main principles that need to be considered here. Number one, contributing to and complying with systems to protect patients. Number two, responding to risks and safety. And number three, protecting patients and colleagues from any risk posed by your health. So let's look at the first guideline now, contributing to and complying with systems to protect patients. You should ensure that systems are in place where colleagues are able to raise concerns about risks to patients. You should also make sure that all staff for whose performance you're responsible for, which can include students and locum doctors, are adequately supervised. Here the GMC is advising that every single person that you interact with needs to be cared for. It's your responsibility, not as a doctor for your patients, but as a professional for the colleagues around you. An example now. A respiratory registrar is told by one of their medical students that they feel drained and burnt out by the level of work on the ward. How appropriate is this response by the registrar in this situation? The registrar tells the medical student that there is a lot of work at the moment and to deal with the problem themselves. Have a go. This is actually a very inappropriate thing to do. Here, they are being dismissive and it could lead to the doctor making mistakes. Remember, you must ensure that systems are in place where colleagues are able to raise concerns. Here, just dismissing them straight away will not achieve anything. You need to make sure all staff for whose performance you're responsible for are adequately supervised. This is clearly not occurring in this scenario. It's a medical student being dealt with, not even a fully qualified doctor, so the registrar really should be a bit more understanding. Even if the registrar cannot give time off, they should be understanding and at least offer moral support at the very least. Overall, it is a very inappropriate thing to do. The next part now, responding to risks and safety. You should report risks in the healthcare environment to your employing or contracting bodies. You should also take action when there is evidence that a colleague's conduct, performance, or health may be putting patients at risk. An example. A medical student sees a consultant who they are shadowing in the pub the morning having 5 pints of beer before the first forward round. How important is this a factor to consider for the medical student? The consultant tells the medical student it was a one-off and that it is the consultant's word against theirs. Have a go. This is actually not important at all. The medical student should ensure that they take action when there is clear evidence of the consultant being unfit for practice. The consultant is putting patients at risk by turning up to the workplace intoxicated, and regardless of the status of the medical student relative to the consultant or the lack of evidence beyond witness, it must essentially be reported. Guideline 3 now. Protect patients and colleagues from any risk posed by your health. This includes making arrangements for accessing independent medical advice when it is necessary. This shows the responsibility you have for yourself because as a medical professional, when your own health is at risk, it will put other people at risk as well. Let's explain this through an example. A doctor has high blood pressure and they prescribe themselves a beta blocker. How appropriate is this response by the doctor in this situation? Is this A, B, C, or D? Have a go. This is actually B, appropriate but not ideal. Surprising to many UKCAT candidates, self-prescribing is actually legal in the UK. Registered and licensed doctors are able to access any prescription drug they want and can also purchase private prescriptions from pharmacies. However, the GMC advises that doctors should be able to make arrangements for accessing independent medical advice when they can, and therefore should avoid providing medical care to themselves. Thank you for watching this free Medic Mind tutorial. For £30, you can unlock all 150 tutorials in our online course. The course covers 4 full days of UKCAT teaching, as well as a course to help you with your personal statement and interview. You're free to ask as many questions as you'd like to our teachers, and with each tutorial you can read along using our 5 UKCAT ebooks covering 500 pages of theory and questions to guide you every step of the way.